Hi, my name is Erica Lona. I'm a counselor at SRJC and I specialize in the health sciences. Today I'm going to talk about different health careers and focus primarily on programs that are offered at SRJC or that you can at least begin at SRJC. So you can see my contact information. Please feel free to reach out and send me an email if you have any questions. So I'd like to start with looking at some of the top growing health careers. So this field is growing and there's specific careers that are growing faster. So I won't talk about all of these careers, but just to point out some of the programs that we do offer at SRJC are in this top growing area. So looking at medical assisting, pharmacy technician, dental hygienist, here it says physical therapist, radiology technician, they call it a radiation therapist, registered nurse. Those are just a few of the top growing careers, and some of those programs are actually offered at SRJC. I like to start with talking about nursing pathways. So nursing is probably one of the biggest programs that we offer in the healthcare field at SRJC, and there's many different ways to get into to become a nurse. And I like to think of it as a career ladder. There's different rungs that you can start at and eventually move up if you would like. So the first rung of the nursing ladder would be CNA, Certified Nursing Assistant. This is a very short program, entry level, but I think it's a great way to explore the career of nursing and decide if it's something that you're interested in. The nice thing is it is a short program. It's not a high paying nursing career, but it is a good way to see if this is something you actually want to pursue. Because as we move on in the nursing pathways, there's more schooling involved. The next rung in the ladder is LVN, Licensed Vocational Nurse. This is a program that's on hiatus at SRJC and hopefully will be coming back soon. So you can check, I think fall 2021 is when we should have an update on LVN. LVNs along with CNAs typically work in skilled nursing or rehabilitation facilities, sometimes hospitals, sometimes community clinics. So those are not necessarily careers that are directly in the hospital. Some hospitals do have CNAs and LVNs, it depends. RN or registered nurse is the program that we offer at SRJC as well. And we offer the associate degree in nursing, but there's many different ways to become an RN. You can do the associate degree in nursing. You can go directly into a bachelor's degree program. From a bachelor's degree, some people would like to continue on and get a master's degree in nursing, maybe become a nurse practitioner or clinical nurse leader. Maybe they want to run a floor, be a manager. So these are all ways you can become an RN. And RNs with an associate degree can work in the hospitals just as a bachelor's degree nurse. A lot of our students that pursue a degree at SRJC, associate degree in nursing, will eventually go on and maybe bridge to get a bachelor's degree in nursing. But again, it's not required. It's just something that a lot of people would like to do, and hospitals like students to be working towards that bachelor's degree. I like to talk a little bit about the pre-professional programs. These are not programs that you can complete at SRJC, but they're programs that you can begin at SRJC. So these are really going to be programs that you're going to transfer to university and then apply to a professional program such as medical school, dental school, pharmacy school. So if you want to become a medical doctor, your pathway would be pre-med. If you want to become a dentist, your pathway would be pre-dentistry, pre-pharmacy for pharmacists. Physical therapists typically major in something like kinesiology or the pre-physical therapist part of a kinesiology major. You do need to get a doctorate for physical therapy, so it's a little bit longer schooling. And another growing career, PA, physician assistant. We do have pathways to prep you to apply to a physician assistant program. Physician assistants, a lot of people don't understand what that is. They're working under a doctor, but independently with a patient. So the doctor isn't in the room, but they're being overseen by a doctor. This is at the same level as a nurse practitioner. So a lot of hospitals and clinics will hire PAs or nurse practitioners to work under a doctor to help more patients. These are all programs that you can begin to work on and prep for at SRJC or any community college or university. So I'd like to just acknowledge that those programs are out there. So if you want to, your dream is to become a doctor or a physical therapist, those are programs that you may not complete at SRJC, but that we could prep you to be a good candidate to transfer. There are a lot of other health careers that I haven't mentioned that are offered at SRJC or other community colleges, and this is not a full list. These are just some of the things to start thinking about, looking into. We have dental assisting, pharmacy technician, both of those programs are offered at SRJC. Surgical technician, so if you want to assist in the operating room. Respiratory therapist, these are professionals that help people that have breathing issues with their breathing therapies. Physical therapy assistant, so working under a physical therapist. Phlebotomist, if you want to work a lab and draw blood. Athletic trainer, if you want to work with athletes and injury and things like that. These are all other health careers that might be interesting to look into. I now want to focus on health career programs that are actually offered at SRJC that you can complete here, excuse me. So I mentioned nursing. We do offer the CNA program. That's a 9-week short program, a good way to get your foot in the door in the field of nursing. The average salary in California is $16 to $18 per hour, so it's not high, very high paying career, but it's a good way to see if this is the, nursing is a career you want to pursue, because you're not committing to a huge amount of time, 9 weeks, versus if you want to become a nurse, you're looking at 4 to 5 years. The other program we offer is ADN, Associate Degree of Nursing, to get your RN. Now, this is a much longer program. It takes about 2 or 3 years to work through your prerequisites. And once you're in the program, it is 2 years. So when we're talking about prerequisites, these are courses that you need to complete at SRJC to be able to apply to the program. So these are classes in general education, math and English and history and speech and psychology, things like that, in addition to your core sciences. So biology, chemistry, anatomy, physiology, microbiology. These are courses that are very important to do well in. So we want to build a great foundation for you to be successful in these courses. Once you complete those courses, you can apply to the program. There's an application. It's competitive, so grades do matter. So be aware of that. Those are things that you want to think about ahead of time, not once you're already starting in these classes. Nursing is a high-paying career. The average starting salary in California is $70,000 plus per year, depending on and can go much higher depending on your experience and education. So nursing, we have one of the biggest programs in the area. We accept 120 new nursing students every year. Other programs nearby, for example, at Sonoma State, that's a bachelor's degree in nursing, accept 24 students per year. So we're a very big program. Another very popular program at SRJC is radiology technician. This is also a program that you will have to apply to, but it's a straight lottery. So if you do the classes and do the prerequisites and meet the minimum of C or higher, then it's a random selection process. This program is much smaller than nursing. They accept about 20 students per year for radiology technician. It's about 1 to 2 years of prerequisites and then 2 full-time years once you're in the program. This is another high-paying career in that you start at about $60,000 to $73,000 per year if you can get a full-time position. A lot of times students will work multiple part-time positions until they get some experience to get a full-time position. Dental assisting and dental hygiene are our dental programs. So dental assisting is what we call a year to career program. There is an application required, but there are not specific prerequisites required. There are some recommended courses that a counselor could talk to you about that might help you be successful in this program, but again, not required. So you can apply, start the program, and in a year be out working as a dental assistant. This is closer to CNA and medical assisting in terms of the salary. It's $16 to $22 per hour. A lot of students will become dental assistants to get their foot in the door in a dental office and to be working with the dentist and get to know people in the office while they're working on prereqs for dental hygiene. Just because you become a dental assistant doesn't mean you have to become a dental hygienist, but a lot of times students use it as a stepping stone to become a dental hygienist. Dental hygiene is very similar in terms of prerequisites as nursing. You have your general education, your biology, your chemistry, your anatomy, physiology, and microbiology. 2 to 3 years of prerequisites. Grades are important. There is an application required. There's GPA requirements, a little bit different than how nursing works. Once you are accepted into the program, it's 2 full-time years. This program, much smaller than nursing, they accept about 24 students per year. The average salary is between $74,000 and $80,000 per year, so a high-paying career. To wrap it up, we'll talk about our last 2 programs, Dietetic Technician. This is a 2-year associate degree program. This is not a program that requires an application. You can begin working on these classes and then sit for the Dietetic licensing. This is about $43,000 per year. A lot of students that want to become registered dietitians will start out as diet techs so they can get some experience in the field. These are people that will work with patients that have illnesses that require special diets. They may work in skilled nursing facilities, clinics, hospitals, different medical areas. Our last career we'll talk about today is medical assisting. This is also a 2-year program, no application required. You can just begin the program. And the average salary is $17 to $22 per hour. These are all programs that SRJC offers and that we can help you map out a plan for you and give you more information if needed. Whatever you decide to pursue, if you're going for a career in the healthcare field, some things to start thinking about is different skills and different academic areas of focus that you could be working on. So if you want to work in the healthcare field, you might, think about your interpersonal skills. So do you have compassion and empathy for others? You care about the well-being of others and you want to help others. You like working with people and helping people. You're kind of that natural caregiver. Good communicator. Now this is a skill that you can get better at and learn and become more proficient at. But when you're working in a healthcare field, you're going to be doing a lot of speaking and writing, especially charting for your patients, depending on what your career is. So gaining those skills, practicing those skills is very important. You also want to work with other people. You like working with other people. You like to be part of a team and a team player, because in the healthcare field, you're not working alone. You're working as a team to help patients. Some of the academic areas of focus you can start thinking about, spending some time on, gaining some skills, is math, biology, chemistry, English, and speech. Now, you don't have to be a straight A student in these areas, and oftentimes, maybe your past experience in high school, middle school wasn't great in maybe these areas, but once you come to college, whether it's the JC or somewhere else, you can go back and work on those skills. So just because you're not doing well in math now doesn't mean you can't get those skills as you continue on in your education. But if you're in math and science and exploring those areas, focus in and see if that's something you're interested in, because those are the type of classes you'll be taking once you get to college if you want to pursue a career in healthcare. So next steps, what can you do now? You can start researching things that sound interesting to you, careers that sound interesting. There's a lot of great websites out there. I'll start by saying maybe go check out SRJC's career development website. There's information on salaries for different careers. There's career assessments to see if a health career would fit who you are in your personality and your values. So career development is a great resource for students to start exploring different aspects of careers. Ask questions and reach out to people in healthcare fields about their experience and their educational background. So if you want to be a nurse and you are at the doctor's office, talk to the nurse. Or if you know anybody that's a nurse, start reaching out and doing what we call informational interviewing. And it can be, you know, not formal, it can be informal, but start reaching out and talking to them about their experience and why they chose that career and how they like it. Also, I encourage any of you to come in and speak with an SRJC counselor, and you can speak to me or any of us that specialize in health sciences to discuss your options and help you find the right path that will fit you and what you might want to do for your career. I've included a link to our counseling office. We do have appointments via phone and Zoom, and we also have drop-in counseling over the phone. I would say continue on in your core subjects such as math and English to help build that solid foundation so that you can be successful in those college level science courses. And ask for help if needed. SRJC and really any college will have lots of support services to help you, including tutorial services. We have programs like EOPS. All of those are to help support you in your success towards your career in whatever you choose. So I want to encourage you all to reach out, and you're welcome to contact me or any of us in counseling. Thank you.